Most of the time, the focus is put onto the mom when it comes to pregnancy. What is she eating? How much weight she's gaining? But actually, guys that do play a big role when it comes to supporting a very healthy pregnancy. It takes a sperm about 70 days to develop. And so, again, that applies to the rapid dividing tissues. So, good 2 months or over 2 months, you're going to have susceptibility to any type of nutrition deficiencies, toxicity, environmental impacts, drugs, and alcohol to producing that very healthy sperm, which will one day hopefully lead to a very healthy child. So, when it comes to nutrition, we want the best nutrition, just like this in this picture right here. We want our guys to be healthy. So, our lifestyles, their diets, physical activity, all of that impacts the development of a very healthy child. Smoking, alcohol, drug abuse, all of this actually not only impacts the quality of sperm, but also the quantity of sperm. There are nutrients that impact women, like folate, and it also impacts our guys. So, folate, zinc, and then, of course, antioxidants in order to reduce any type of free radical or oxidative damage. All right, guys. So it's a very common misconception that you don't really need to start thinking about what you're eating for the baby until you become pregnant. But that's actually false. We need to start thinking about it at least 3 months before conception. If you are overweight, we try to recommend to obtain a healthy weight, not necessarily by a BMI or ideal body weight, but whatever is healthy for you that decreases your risk of weight related comorbidities or disease. Some potential risks when it comes to being overweight, it could be infertility, type 2 diabetes, hypertension, having a large baby, which would include a higher risk for a C section. It also increases the risk of birth defects, preterm delivery, and then also that baby's potential risk for becoming obese or overweight themselves, and then also having those comorbidities or diseases. Being underweight also impacts the risk of having infertility itself or also a miscarriage, having a low birth weight baby or a small for gestational age baby, and for that baby to develop potential disabilities or lung diseases or even the sudden infant death syndrome. Technically, a baby that is born before 37 weeks is known as premature or preterm delivery. If a baby measures less than the 10th percentile for their gestational age, meaning whenever they are born, let's say that a baby is born at 35 weeks, they're going to use a height, and not height, but a length and weight graph that measures what a healthy 35-week gestational baby would be at. And so it's not going to be the same type of graph that a 40-week old baby would be measured to. That wouldn't be very accurate to measure that compared to a 35 week. So they'll use one that's specific for a gestational age. If they are measuring below a 10th percentile, then they are known as small for gestational age or SGA. Low birth weight is technically less than 5 pounds and 8 ounces, and then below that, there's a very low birth weight and an extreme low birth weight as these numbers in weight begin to decrease further. Potential things from the diet that could impact a healthy developing fetus is something like methyl mercury. This is something that can accumulate as a result from pollution of industrial sites. So, if I always kind of give the example of if you go to Galveston, you notice that that area is surrounded by a whole bunch of factories, and those factories are emitting pollution. As that pollution goes up into the air, it is suppressed by weather and rain. And it rains back down onto the ground, and that begins to run off to rivers, creeks, and eventually it meets the ocean. Whereas that methylmercury begins to accumulate in things like seaweed, and then the little bitty plankton that eat that, and bigger fish that eat that, and so forth up the food chain. The bigger that species is, the more of that methylmercury potentially has accumulated. So, if you know fish or you're a fisherman, then you may know what types of species of fish are very large and therefore should be avoided during these critical times of life development. One of these, of course, is what we're talking about is pregnancy, but it could be infancy, childhood, and also older adults with incompromised immune systems. But with that said, we know that fish and some of the nutrients or even non nutrients that they provide can be very healthy for a developing fetus and their brains, like omega 3 fatty acids. So we don't want to say don't eat fish. Instead, we specify exactly how much to eat of which type of fish. Technically, if it is a low mercury fish, it's recommended to eat up to 12 ounces a day. What's low mercury? It can be shrimp, canned light tuna, salmon, pollock, and then catfish. What's very large in size, you probably could guess a shark, but a swordfish, king mackerel, and tilefish. Also, some species of tuna like big eye tuna. Another sector is to eat but limit. So we still want people to eat fish, but limit albacore or white tuna to less than 6 ounces per week, and then less than 4 ounces a week of mahi tuna. I'm sorry, mahi, halibut, snapper, and striped bass. So what does 4 ounces look like? Well, some of those tuna cans typically are anywhere from about 4 ounces to 6 ounces in size. Talking about potentially harmful substances that could be ingested during pregnancy, well, we have to talk about caffeine. It's commonly a myth that pregnant women should not have any caffeine during pregnancy, but that's absolutely not true whatsoever. It is actually the amount. It's like I said before, it's the dose that creates the poison there. And so, general recommendations can be anywhere from 150 milligrams of caffeine a day, as far as limiting, up to about 300 milligrams a day. Research varies on its views of what is that exact cutoff. So, I always say let's go with the safer limit. Let's lower it to the lowest one just to be on the safe side. We are dealing with another human being, not just ourselves. But if you can see, if we're looking just coffee itself, in 8 ounces, which unfortunately most coffee shops do not just serve 8 ounces, the lowest one is usually about 16 ounces. It's going to provide you around 85 milligrams per cup of that. Of course, if you get something stronger like an espresso or high energy drinks, those are going to provide a lot more caffeine per fluid ounces. So we have to be careful and just make common sense um, decisions or recommendations and if you're a healthcare provider to make sure that we are limiting it. We don't need to be drinking energy drinks or Mountain Dews during this time. But let's say a pregnant woman wants a little bit of tea or maybe occasional diet soda. That's absolutely okay, as long as she's not taking in several at a time or exceeding this recommendation of 150 milligrams. You guys, I know it goes without saying that alcohol should be avoided during pregnancy. Every once in a while, you'll still hear maybe a great aunt or a grandmother, great grandmother that will say, "Oh, it's fine to have a small glass of wine," but in all actuality, you really don't know what that threshold is for each individual, and so it's better just to avoid it during that time. So, if alcohol is consumed during pregnancy, it increases the risk for something known as fetal alcohol spectrum disorders, and they have a wide range of signs and symptoms that can present. You're looking at some of the physical symptoms here, such as small eyes, having a very thin, you can see in this particular picture, very thin upper lip here, upturned nose, a smooth philtrum. And so that is that little crease that's usually connecting from the nose to the mouth. A lot of times that is not something that is visible for those who have been babies that have been exposed to alcohol. Having a very flat nose bridge, you can see more of that during on these couple here. And then some deformities related to your limbs or extremities, joints, fingers, of course, delayed or slow growth, vision or hearing problems, heart defects, and problems with different organ systems like your kidneys. So overall, it's just not worth the risk when it comes to having alcohol during pregnancy. Now, something that might not be as well known is the potential side effects when it comes to consuming herbal or botanical products during pregnancy. And a lot of products out there on the market are actually marketed to pregnant moms or maybe potential moms who are trying to become pregnant. And in fact, we know now, or hopefully you do know now, that supplements are not regulated and can really pose very dangerous side effects when it comes to all people, but especially those in vulnerable situations like during pregnancy. Taking any type of herbal or botanical supplement could potentially cause something like a miscarriage, seizure, stroke, heart attack in a brand new baby. It can also block vitamin absorption. So, if you think about folate and how important it is, it could block that, resulting in something like spina bifida or another type of neural tube defect. Even something as common as green tea or green tea extract can cause potential harm as it could block different nutrients like folic acid. You will often hear of some very strange things that women crave during pregnancy, and a lot of that happens to do with a heightened sense of taste and both smell, mostly likely occurring from the hormones that are changing during pregnancy. Very commonly, most women tend to not like the smell of coffee. That did not happen to me. I happen to love that all the time. But this would be a great thing since we need to limit our caffeine. Highly seasoned foods, fried foods. I would also add aromatic foods, things that kind of waft when they are cooked, something like broccoli, for example. Fish sometimes. Those are all completely normal, but something that is abnormal is known as pica. Pica, or sometimes called pica, both of these, however you want to say it, is the craving of non food substance. So, what is a non food substance? Well, that's pertaining to all of these pictures here. Looking at this one, this is ice, and technically it is a non food substance because it's not contributing anything but as far as a nutrient, macros, micros, etc. And so if a woman is completely craving this nonstop, they'll fill up on ice and not receive the nutrients from food instead. So you can see how that could be an issue. Um, some women might crave things like chalk, detergent, soap, soil, clay. Now, this particular one can be something that is craved because of hormonal changes, but it also is very cultural too, where some areas around the world will kind of have this tradition of consuming clay and thoughts that that helps to promote a healthy pregnancy and child. Of course, if you're eating anything from the ground, that poses a potential for parasites and bacteria. Of course, if your body cannot digest it, that leads to a gastrointestinal obstruction, which would require surgery. It can lead to nutrient deficiencies because these types of things are going to block nutrients from being absorbed. Heavy metals, of course, are toxic, and then other types of chemicals that are in those substances obviously can cause some adverse effects. There's no scientific evidence, and I would uh, encourage you to understand this concept here because I hear it so often that if a woman is craving ice, that means she is iron deficient. Now, if you were to look at this in the research, you will find many different studies that will say ice is associated with iron deficiency during pregnancy. And that is an association most of the time because you don't know if the reason why she's iron deficient is because of the ice itself. She's already deficient and she craves ice to try to tell your body that you need more of it, or because she's eating so much ice that she's not eating a lot of nutrients. So there's nothing definitive, despite what you might see out there on some studies, that actually links these cravings here to specific nutrient deficiencies. Now, I believe that pregnancy is a very special and very precious time, but it does carry along with it some discomforts. Number one type of claim of discomfort is that morning sickness, which is just nausea, but you should know that can occur at any time during the day, not just the morning. It just happens to be a little bit more prevalent during the morning, which may be because the mom doesn't have has an empty stomach, and so you're more susceptible to that nausea at the time. Maybe due to the heightened sense of smell. This stands for nausea, vomiting. Could be emotional stress. It could be traveling. All of these that may slightly disturb you when you're not pregnant may really be exacerbated during pregnancy. What do we recommend? Well, that's very highly individualized, meaning that we need to really sit down with mom and talk about some different things and eliminate what may be the cause and treat the actual cause. So, what do? We focus on having very small, frequent meals that are high in carbohydrates. Now, I need to make a side note here because it should be simple carbohydrates here. Simple carbohydrates, meaning I don't want mom to eat a whole bunch of fiber because that makes it stay in her tummy a lot longer. meaning that it can also cause more hydrochloric acid going in there that could aggravate nausea itself. So think about easy to digest. Usually the types of carbs that we're saying stay away from exceeding high amounts of that in your diet. This is the time we want to have those very easy, like think about white bread, white crackers, white rice, all those types of low fiber carbs. That's completely fine. It tends to be a little easier on the tummy. Think about yourself. When you are sick, maybe you have a virus, then you don't want to go and eat a bunch of really, you might think of it as foods that are something you have to chew a lot of, that stick in your stomach a long time. You want something that's easy on the stomach, like chicken noodle soup. That's very simple carbs. Maybe some juice, maybe some soda. All of those are very simple carbs that are more easily tolerated when you have nausea. Same thing applies during pregnancy. Another thing is salty food. Salt seems to also be something that helps, hence chicken noodle soup that is full of salt. Very different though is sour and tart beverages. This for some reason helps to really settle the tummies of some moms during pregnancy. And then B6. B6 is an initial over the counter treatment that could help treat some morning sickness in certain moms, but doesn't help everyone. And last but not least, but there is ginger. Ginger is also used to treat things like motion sickness and may help some moms who are suffering from morning sickness. So if I give you a good example of this picture right here. So you have ginger, and you really have to look for real ginger sodas. Most of them are just flavored with ginger, but it's artificial. Real ginger sodas. Then you can look at something like this salty. We got salt, we got a simple carb here, and we usually recommend for mom before she ever gets up out of bed, just keep this by the table and taking this in, give it some time to digest and settle, usually helps a little bit at least alleviate that morning sickness. If we want to throw in that sour or tart beverage, we could also add a little lemonade that is also a simple carbohydrate. If it begins to get very severe where mom's not able to keep down any food, or at least the majority of her food, snacks, meals, and we start to worry about dehydration, electrolyte imbalances, and even weight loss, of course, that affecting the developing fetus, then we're going to determine that that is more likely to be hyperemesis gravidarum, and that is a severe case of this nausea and vomiting that occurs only during pregnancy. Usually leads to being admitted to the hospital, receiving IV fluids, and also tube feeds in order to sustain good nutrition for that baby. What you're looking at over here is another example of something to help settle the stomach. This is known as Preggy Pops. With this, you're getting some of these things. We're not going to treat hyperemesis gravidarum with this, but this might have some sour tartness to it. It could be lemon flavored. It's going to have simple carbs because that's a sugar within that candy. And some of them will also incorporate things like vitamin B6 and ginger into them as well to help kind of with that morning sickness phenomenon that occurs during pregnancy. I think this slide really represents the reason why we have so many discomforts during pregnancy. If you look at this picture here, where is mom's intestines here? You can't see them because the baby's taking up the majority of the room. Stomach is being pushed up really close to the esophagus, and that is what tends to lead to something like heartburn. Then we have a slow GI motility. That means that everything's being slowed down. We have the baby that's compressing on those small intestine and the large intestine, but also our body is just designed to go very slow during pregnancy because that helps that all those nutrients that are going throughout the small intestine, they're slowly going through there. That gives them more contact time, more chance to be absorbed. Therefore, that's increasing the amount of nutrients that that baby's receiving from mom. Um, if a mom is experiencing heartburn, some things that we try to do is we have small, frequent meals. The less we put into the tummy, the less of those gastric juices that tend to aggravate heartburn. We limit high fat foods because fat sticks in the stomach the longest. Again, more likely that that gastric juice backs up into the esophagus. We also recommend that anybody that suffers from heartburn, they remain upright after eating about anywhere from 60 minutes to preferably at least 2 hours. More common things that tend to exacerbate or make worse of heartburn: caffeine and spicy foods. I would say fried foods on top of that. When it comes to another issue that most women will also at least encounter in the, I would say, final trimester, is the accumulation of fluids known as edema. Edema is that swelling of the feet, and that's because all of this pressure that is coming from the baby is really pushing on the vascular system, and that blood fluid is being pushed out into the tissues. And so you have kind of that pitting edema, which is when you push on the foot and your thumbprint stays in that foot. That is pitting edema, and that's just because of overall increased amount of fluids that mom is carrying around during this, especially during the late time of pregnancy. Pregnancy is one of those times where the immune system is weakened, meaning that that mom is going to be more vulnerable to different types of infections. Therefore, we have to be really careful about the safety of our foods. You see, pregnant women are more susceptible to something known as listeria, and we'll see that here in just a moment. We know already, we shouldn't eat foods that have been left out at room temperature for a very long time, things that are undercooked. Think about like a very rare steak or maybe deli meats. These things are not heated up, and heat tends to kill more bacteria and parasites than, of course, those that are at room temperature. So, those that are more likely to cause a foodborne illness during pregnancy are those that are undercooked, any type of meat, unpasteurized milk, which when you pasteurize something, that is a slow heating process that kills the bacteria that could cause harm. Uh, any type of unpasteurized cheeses, which tend to be some of the soft cheeses or Mexican style cheeses. These have the potential for really causing something known as listeria or listeriosis. Raw, Brussels sprouts tend to be more likely to carry something known as E. coli, and that's because of that very dark, damp environment that those are grown in. It really just feeds the perfect storm for bacterial growth. As I mentioned on the last slide, is that those things that are unpasteurized tend to carry a greater risk when it comes to something known as listeriosis, and that is an infection caused by the bacteria of listeria. This one, pregnant women are a lot more susceptible to, 10 times more likely. If you are Hispanic women, 24 times more likely, and that just happens to do with more of kind of food choices or preferences with that. Listeria can result in miscarriage, stillbirth, or even a fetal infection that can lead to some severe physical or mental disabilities. If we think of those things that are most likely to cause or to be carrying that bacteria of listeria, we think of soft cheeses like brie, feta, camembert. You can see some of these other ones. Queso fresco is another more common one, and only if it's unpasteurized. I will tell you a quick trip around even the Delhi area of HEB. Majority of them are actually pasteurized. It's not something that you have to worry about. But let's say that you go to more of a smaller market. Those might be more likely to carry the unpasteurized version of those cheeses. The next one is actually a parasitic infection that's known as toxoplasmosis, and this is more likely to occur, poor little thing, by a little kitty. These kitties, they tend to be more likely to carry a parasite, and of course, they use litter boxes, and if the pregnant mom, she changes the litter box, she comes in contact with that parasite, and then she might transfer that parasite onto the kitchen surfaces or food surfaces. Even if she washed her hands, it might not have been good enough to get away from that parasite underneath the fingernail. And that particular parasite is more known to cross into the placenta and can cause an infection within the baby that can lead to irreversible damages within vision, hearing, and also cognitive development, even resulting in seizures and death.